Hi everybody, my name is Wendy Gonzales. I'm an emerging voice 2012. I come from the University of South Carolina and today I'll be presenting our study on assessment of perspective of factors involved in the regional health partnership. So global health partnership has been successful in many things. They have raised the profile of certain health problems on the policy agenda. They have mobilized resources. They have generated an overall positive impact on health outcomes. However, as in any other partnership, global health partnerships bring together a different set of actors such as private donors and country partners. These actors have very different and sometimes conflicting perspectives, interests, and agendas, making the development of a global health partnership a very difficult process. So the question that we raise is how can we systematically assess the perspective of factors involved in partnership? And to do this, we examine the development of a regional health initiative. This initiative has the goal of backing the efforts of country partners in reaching the Health Millennium Development Goals by supporting effective interventions to improve reproductive, maternal and newborn health, maternal and child nutrition, and immunizations. We use a Laswell policy science framework to assess perspective. According to Laswell, perspectives are made up by three components. The first component is demands, and it answers the questions, what do actors want in terms of values? These values can be power, learning, wealth, well-being, skills, relations, respect, and integrity. The second component is expectations. What assumptions do actors make? And finally, identities is on whose behalf are demands made. We use prospective analysis to document the development of regional health initiatives. We collected data through participant observation of key events of meetings, documents reviews, and conducted in-depth interviews with key participants. We transcribed the interviews and used in vivo for data analysis. We used a star list of codes based on Laswell Policy Science Framework to code the data, but we also conducted inductive analysis that helped us identify emerging themes. The Regional Health Initiative had 5 different actors. These actors came together with the common goal of improving the well-being of country partners by improving maternal and child health. However, each of the actors also had other expectations and demands about the initiative. For instance, Donor 1 was interested in learning. He wanted to use evidence in the decision-making processes and generate new evidence about maternal and child health outcomes. Donor 2, on the other hand, was interested in building skills by using resources efficiently and achieving rapid changes. Donor 3 was interested in giving power to the countries and supporting decisions made by the country about their operation. The multilateral agency involved wanted to establish relations and build new partnerships with private donors. Finally, the country partner was interested in having enough power to make decisions about the operations that were consistent with the rules and priorities. So, even though there were 5 actors that had a common goal, each actor had other expectations and demands that were not explicit at the beginning of the development of the initiative, and the actors did not discuss these different expectations and demands. So the lack of alignment of perspective caused unintended consequences to the country operations, and these consequences were mainly three. One was the establishment of unrealistic goals. The second one was the tension during the design of the country operation, and finally there were unexpected changes to the country operations. One donor was interested in showing results in the short term, so the country operations could only last 18 months. Other actors did not agree with this decision. One person commented, That is the mentality of an investor from the private sector who does not know the changes in the social sector in their own time. It is a condition that is clearly detrimental to the legal process. The lack of agreement among actors delayed the development of clear rules and regulations about the initiative. Without clear rules and regulations, there was a lot of tension and confusion during the development of the country operations. One participant commented, there was not a lot of clarity. During the continuous process, one of the biggest weaknesses had been the lack of clarity and all the indications had been changing permanently. They kept changing the rules of the game. Finally, one country operation was designed to support building infrastructures. When the donors reviewed the operation, two donors opposed the decision of funding infrastructure while one donor supported it. One person commented, two donors rejected financing infrastructure. That was the first big discussion they had among themselves to align their interests. So it was decided that the initiative was not going to fund infrastructure. We had to go back to the country to realign this. So, in conclusion, prospective analysis of perspective is not only possible but essential for the development of a health partnership. Gaining an understanding of actors' perspective can facilitate the process of development of a global health partnership and prevent unintended consequences to country operations. Thank you.